Hello, everybody. Brief moments of reflection at the start of our forum meeting this time. And we wanted to let you all know of the sad passing of Professor Phillida Parslow this month, aged 90. Professor Parslow was inaugural Professor of Social Work at the University of Bristol, and she was actually the first female Pro-Vice-Chancellor, the Warden of Wills Hall, and Emeritus Professor in the School for Policy Studies at the University of Bristol. She was actually well known. She had a long and distinguished career and was regarded very highly in the field of social work across the UK. So a sad loss for Bristol right now, but there is another connection. We were lucky at Age Concern Bristol, as Age UK Bristol used to be called, but Phillida was a trustee of ours for 13 years. And she was actually the inspiration behind this very forum. She inspired the University of Bristol and Age Concern Bristol to collaborate on setting up the forum. And over the years, we've gone from strength to strength. We now have UWE and Brunel Care, so the four organisations jointly pulling together this regular forum. And so we wanted to reflect at the outset very briefly on Phillida's lifetime achievements and her legacy to all of us in terms of this forum, which, as I said, is going from strength to strength, and I think is informing the way that we work in Bristol and further abroad too. So if anyone would like further information about Phillida or her achievements, I'd be very happy to send something on, to send an email if you'd like to get in touch either with me or with the organisers of the forum, through to Claire Chivers. Happy to send you some more information. And thank you. We just wanted to mark Phillida's passing at the beginning of our event today. Thank you.
Okay, thanks, Kay. Like I said, we got two presentations for you this afternoon, roughly around 20 minutes each. The first presentation then is with it's a student-led presentation around consulting in the third sector by Jack Elliott, Calvin Kearns, and Axel Schörner. I shall hand you now over to. I'll stop sharing my screen. I'll hand you over to the three very, very capable hands.
Thank you, Gary. We're really grateful to be here. So the kind of short overview of, I guess, what we'll be doing today, and also an introduction to ourselves. CSRN is a global network of students offering pro bono consulting services to the third sector. We've had the pleasure of working with Age UK Bristol, as well as a number of other charities within the region. And so today we'll be going over broadly kind of who we are as an organisation, as well as some of our work with Age UK Bristol, and then I think our broader activities within the research space. And so to kind of introduce myself, as well as my two peers here today. So my name is Jack Elliott. I'm an incredibly proud and recent graduate from the University of Bristol. I studied economics and finance, and it was during my time at the university when I was lucky enough to work with Age UK Bristol. Calvin.
Yes, so hi everyone, my name is Calvin. I am the COO of CSRN. My background is I am currently studying business in University College Dublin, spending this year on internship working in Microsoft, and looking forward to making this presentation today.
Go Axel.
So hi everyone. My name is Axel Schörner Emelin. It's not the easiest name to pronounce. I am going into my second year now at the University of Warwick studying economics, and I'm the head of research at CSRN. I'm really looking forward to telling you more about the organization and what we do.
So I suppose we could kind of start with our introduction to CSRN, which I'll talk about, and then we'll move on through its presentation. So next slide, please, Jack. So as Jack said, CSRN is an online platform connecting student groups with high impact consulting projects. We were launched in the wake of lockdown last year to empower the world's brightest students to engage in third sector management consulting during the pandemic. Our goal is to connect the leaders of social impact organisations with a global network of student consultancies working together to support as many charities and social enterprises as possible. We also exist to support these teams in delivering their projects, and we do so with the support of specialist corporate partners to ensure that these projects are delivered to the highest standard of student consulting. We also support these projects ourselves at CSRN, so we offer centralised support functions such as data science and analytics, graphic design, research, which Axel heads up, training, as well as client services. Next slide, please, Jack. So our aim overall is kind of to bridge the gap between talented students and organizations most in need of support. So we see this as really a win-win situation. So on one side, we have thousands of talented students who are passionate about social impact and consulting, and they're looking for experience to distinguish themselves in the workplace after college. On the other side, we've got thousands of amazing organizations who are driving social impact in regions impacted by crises who are looking for support. And by connecting the two, we really do see the win-win situation over the past 16 months, because on the student side, they get impactful experience, which makes them more confident and employable. They can then use their talents to make a real difference to the world around them. And then on the organizational side of things, they get access to high quality consulting free of charge, which allows them to really focus on what they're best at, which is making a difference. And then from there, social impact is then created. So we're not alone in our cause. We are supported by a global network of talented students passionate about driving social impact. We have over 45 branches from around the world based on, I'm pretty sure, every continent except for Antarctica, because for obvious reasons. And without them, none of this would be possible. We've got the likes of Cornell University and UCLA over in America. We've got student groups such as the Irish Student Consulting Group in Ireland, as well as 180-degree consultant branches from around the world, such as India, a couple of countries across Europe, as well as Singapore. So we're really lucky to be supported by such a variety of branches from around the world who help us kind of drive that social impact. Next slide, please. So what we've achieved so far. So in our 16 months since launch, we've managed to help over 300 charities across 5 global responses. So initially we had our first response in April of last year, which was a UK-led response, working with charities such as Bristol Alive Activities, Age UK, and the Bristol City Council. We moved on from there to our Beirut response, which only finished up in the summer of this year, where we were lucky enough to work with over 75 NGOs across the country. In January of this year, we managed to work in Africa in a couple of countries, and that was a really, really exciting response. We worked with over 35 clients there. We had our First Steps program this year, which was the first of its kind, connecting A-level students with social impact organizations, which was a great success for us. As well as that, we had our India response, where we were lucky enough to work with the clients such as Habitat for Humanity, and got to work on some really interesting projects and meet some really interesting people along the way. That's still ongoing. We're in the middle of that. And recently enough, we have begun our Malaysia and Indonesia response in response to the COVID crisis that is ongoing in those 2 countries. Again, we've been really lucky to work with some amazing organizations such as the United Nations Global Compact Network, as well as the UNDP. Even more delighted in the fact that we were recognized last year by the UK Prime Minister, who was quoted as saying, "Your army of volunteers are turning their talents from analysing data to management strategies and showcasing a spirit of collaboration and ingenuity which embodies the very best of Britain." So again, we're really proud of the work we've managed to do over the past 16 months and looking forward to see what we can do in the future as well. So now I'm going to pass you over to Jack, who's going to talk a little bit more specifically about the projects we've done with Age UK. So over to you, Jack.
Thank you, Calvin. Can everyone hear me okay? Yeah. Great. So I've got the pleasure of going through, I think, some of what is some of my proudest work to date. And it's, I mean, it's a bit of a story, but to kind of kick off, I wanted to tell the story about how it all started. So when I was at university, myself and a few of my peers set up a consulting services for charities in the Bristol region. You could say worried about how we're going to go about securing our first project. We quite boldly just walked into the head office of Age UK Bristol, where we were lucky enough to bump into Kay in the lobby. We sat there and had about a 10-15 minute conversation with Kay, not really knowing who Kay was in terms of, I think, where she sat in the organization. And she was kind enough to kind of put her faith in us in terms of her time and trust when we started working together on a variety of projects. So from 3 very baby-faced Bristol students kind of mindlessly walking into the Bristol office, I'm looking forward kind of to almost 2 years now. We're proud to say that we worked together on about 5 projects, which have spanned kind of digital transformation, digital fundraising strategy, also looking at community engagement, as well as kind of wider expansion plans. And so what I wanted to do today was, because they're quite broad projects, but given the nature of kind of today's forum, was really hone in on the kind of research activities, which I think informed our decisions, as well as the wider projects. So kind of where it all started was this kind of digital transformation piece in terms of helping Age UK Bristol understand ways that they could go about innovating their financial reporting activities. And so in order to do this, we researched a wide variety of financial reporting tools, such as QuickBooks and Xero and the kind of whole ecosystem, trying to understand the one that we thought best aligned with the existing processes at Age UK Bristol. In line with that, the next challenge was, how do we use this data? And so we started conducting research into data visualization tools and kind of automated process that would enable Age UK to really leverage this modern technology. So on the research side here, kind of conducting research into the wider ecosystem, but I think also into the kind of implementation side of things in terms of how Age UK could actually leverage this technology. Off the back of this, I think we built a beautiful relationship with Age UK Bristol. I'm very grateful to still be kind of working loosely with Kay. And when COVID-19 kicked off, myself and Kay then had a conversation around kind of the impact of COVID-19 on Age UK Bristol broadly, their kind of finances, as well as their ability to engage with the community. So we started on our next project quite quickly. The first one looking at new ways that Age UK Bristol could go about engaging with the community at a kind of outreach and fundraising level, exploring the use of digital marketing for the first time. So in this kind of particular instance, we were researching best practices in digital fundraising, helping identify kind of online payment collecting or kind of fundraising channels, and also I think best practices when it comes to the launching of fundraising campaigns. And so we kind of compiled a big research report on our findings, and then worked with Age UK Bristol to kind of implement and launch ultimately a fundraising appeal. I think this is the one that I really want to speak about today, though, which was our work around the kind of expansion of the service offering. And so we did one piece of work prior to this, which was helping look at new ways that Age UK Bristol could go about engaging with the older people community during COVID-19, in particular lockdown. So looking at kind of new activities by way of getting physical, such as Taekwondo, and looking at a kind of potential partner ecosystem within the local community. What we have here is a kind of review of the wider activities which were being done by other similar organizations. So we mapped out a total of, I think it was 56 different service offerings that the charity could implement based on what was being done by other Age UK branches, as well as other charities within a similar space. So you can see here from the examples, we've got things like home care, personal care, looking at IT training courses, kind of phone a friend schemes, and a kind of really wide variety of activities which they could implement. Off the back of this, so we've kind of got here some initial kind of listings of our findings, but then we did a lot of research into the viability of actually integrating these as part of their wider service offering. So off the back of what we've got here is what's called an impact feasibility matrix, trying to understand the benefit that these services are bringing the community, as well as the feasibility of Age UK actually implementing them internally. What we did off the back of this then was based on this kind of top quadrant here. So the kind of three services that we had identified, which was home care, IT training courses, and online classes. We then did further research into the kind of practicalities of introducing those services. And so we've kind of got here at the bottom a screenshot of one of the slides going through the nature of home care as a service in terms of the technicalities of the actual delivery, looking at how specialist the different areas of support were in order to understand the viability of kind of rolling this out as a service. We've also then got kind of here some high level findings in terms of the kind of wider learnings that we had from the network. But I mean, it was a really fantastic piece of work, and we were really grateful to be in a position where we could work with Age UK on this. Hand over briefly to Axel now.
Fantastic. Thank you so much, Jack. Can everyone hear me? Yeah, looks like it. Fantastic. Thank you so much. To remind you, my name is Axel. I'm the head of research at CSRN. The way I really see it is that the research team has mainly two purposes: to produce research-based material that provides value to CSRN and to its clients, and then also to ensure that CSRN uses a science-based approach. And so I will give you a brief overview of the team, of some of the previous research we've done, and what some of our future plans are. So here, as you can see, historically, the team has comprised of 8 to 10 talented students from universities all over the world. currently we're undergoing a bit of a restructuring, but that is just to produce more regular content. Overall, our primary objectives have not changed. They are to support the global response efforts by CSRN, they're to support CSRN's more internal processes, and then to conduct research into humanitarian crises. If we go to the next slide. So first, I'll talk a bit about sort of the global response effort and the research we do for them. And India, the India response report was really our latest one. So we looked at COVID cases, deaths, vaccination rates in regions of India over time to see how it changed. And all of this was really to adapt our response effort to best provide relevant services to our clients. Then we also contextualized this by looking at socioeconomic factors, looking at gender, the urban-rural divide. So some of the sort of key insights you got from the report, you can see here to the right, you saw that, for example, women were worse hurt economically seen than men, as you had a widening gender pay gap. You saw more domestic abuse because of lockdown. And funnily, interestingly enough, you saw that despite there being higher cases in urban areas than rural areas, you still saw that rural areas in many cases were worse hurt due to being more vulnerable, sort of a lack of internet connection preventing them from going to school, biomedical waste being dumped in rural areas. You saw a bigger hospital bed shortage in rural areas than in urban areas, and you also saw a shortage of vaccinations. And if we move on to the next slide, we also do a bit of work into sort of the internal processes at CSRN, and the biggest work we did there was really the creating the social impact evaluation framework or measurement framework for CSRN. Some of the difficulties we of course faced was, first of all, that CSRN is quite a young organization, only a bit older than a year, and then also secondly, that nature of the work we do is quite hard to quantify simply because we have is through our client. So what we did was we designed the framework, we collected the data we could, and you see some of the key metrics here to the right. We put in over 60,000 volunteer hours. We've worked with about 50 branches, and really looking at our net promoter score of 78% was a very high score, something we're very proud of. And really it does demonstrate the impact that we have around the world. To the right here, we have the priority cause segmentation, which is not in fact a part of the impact evaluation report, but it is still part of the internal processes to sort of optimize CSRN and ensure that what we do is really using the resources we have as best we can. So what we did in practice was that we categorized charities by geographies, by the operations, and by the activities that they do to really help us segment our own clients to provide better or rather more suitable services and really aid our work in that way. If we move on, so looking at sort of where we're headed from now on, once the restructuring is done, we're looking at producing some similar content, but also a lot of new content. So we'll continue looking into sort of which regions to expand to, where we can have the biggest impact. We're looking at doing a bit of ad hoc research, looking into lesser known crises, things that don't necessarily end up in the news. Over here, you can see a few images, and that's actually from an unpublished report we did on Lebanon after the Beirut explosion, where we used a machine learning actually to get some interesting insights from that. Furthermore, we're hoping to hopefully produce some material that is useful to clients, such as guides on how to use digital technologies, and then perhaps in the future also provide research in and of itself as a service for clients and really give them that edge. That covers everything on the part of the research team, and I would just like to thank all of you for listening to the presentation. I hope you've enjoyed it, and I hope that you will read more and follow CSRN in the future.
Thanks, Axel and Calvin. So that gives a bit of an overview of, I think, kind of what we do as an organization, as well as a kind of whistle-stop tour of some of our work with HBK Bristol. I think one of the things I'd like to take off the back of this, given the nature of the forum today, is I think we're incredibly proud of, I think, the work we do, and I think it's also indicative of the power of students within the field of research. Kind of across the spectrum, it's been really incredible to see what students have been able to achieve with their research activities, and I think also the benefit that that has for the third sector. So we're really grateful to be in a position where we can continue to, I think, provide students with these opportunities and leverage student talent in terms of supporting the third sector through what have been some really difficult times. So I believe there's a Q&A at the end, and we'd be delighted to answer any questions. You can find us online, and I will also put our contact details in the slides, which I believe may be shared out at the end of the session. So thank you, Kay, for the invitation to speak today, and to everyone else who listening to our story.
Well, thank you. It is, I don't want to sound patronizing, but that was incredibly insightful and a hell of a lot of work. So that's really impressive stuff. So I'm sure, and you were kept to time as well, which is absolutely perfect. So we will come back. I'm sure there'll be loads of questions at the end, but thank you very much for that. I believe, Linda, you're okay to share your screen for this? I'll just introduce you.
Yeah, sure.
While we're doing the jiggery pokey with the IT. Linda's going to be talking about engaging families in older people's home-based reablement. It's a realist inquiry, which I'm really interested to hear more about, because I'm getting more and more interested in realist approaches myself. Even though I'm a hardcore experimental psychologist, I'm moving. So I'm listening with a lot of interest in what Linda has to say about the realist inquiry. So over to you, Linda.
Thanks, Gary, and thanks to everybody for organising today. It's nice to be on this side of one of these forums. I've been coming to them for several years, and actually this is a particularly exciting one because this is the first presentation I've done since having got the doctorate. Excuse the sounds in the background. There was a rabbit who's suddenly woken up and got excited, so sorry about that. But just if you wouldn't mind waving, just so I know you can hear me. Yeah, and you can see the slides now. Also wave if you can. Can you see the slides? Yeah, great. Okay, so yeah, I've come to a PhD relatively late in my career, having managed several projects in the voluntary and community sector, mostly related to disability, but also working with Alive. I can see some people from Alive here, or former people, people who were formerly with Alive, working on meaningful activities for older people. And that was the project that I ran, was funded by Kay Libby, who was at the council at the time. I'm also a volunteer with BAB. But the doctorate that I did was funded by the University of the West of England, and I was supervised by a multidisciplinary team. So that included a public health specialist, an occupational therapy specialist, and a specialist in assistive technology. So a really nice mix. So today I'm just going to show you a few of the highlights from the findings, and the study is focused on engaging families in older people's home-based reablement and the implications that has for the field. And I will explain what I mean by reablement for those who are new to it. Slide. Yeah, but why in the first place have I focused on family members? Well, in the context of support for older people, we know that a fair amount in general, rather, about the role that family members play, and this includes partners when I talk about family members. So in England, we know that the bulk of older people's care is provided by family members, and that the hours of care provided by relatives is increasing all the time. We know that there are many more unpaid carers than paid carers. And again, the number of paid carers is reducing all the time, struggling to find them. We know that most of us will play a caring role of some sort at some point in our lives. And we also know that high numbers unpaid carers worry about the impact that role has on their everyday lives and relationships. For those of you who are less familiar with what reablement is, this slide explains a bit more. Essentially, reablement is an intervention that supports people to learn or relearn how to accomplish daily tasks like washing, dressing and cooking, usually following some sort of deterioration in their health. So the easiest way to explain it really is to contrast it with traditional care. So traditional home care is about doing things for people, whereas reablement is about helping people to do things for themselves again. And that might be doing them in a different way or with the aid of equipment of some sort, but it's that difference that is critical. So for example, you might get a home carer who would arrive at somebody's house and the first thing they might say is, "Oh, good morning, Jane, how are you? Let me get you a cup of tea." Whereas in the case for a reablement worker, they might be more likely to say, "Good morning, Jane, how are you? Make me a cup of tea, will you?" So that's just a little example of the way that they might work. It's tasks like that that they've agreed at the start of an intervention that somebody would like to be able to do for themselves again. And the reablement worker will constantly be reassessing that person's ability to accomplish these tasks and will stand back or step in accordingly, aiming to provide less and less help, hands-on help over the period of the intervention. So essentially it's a short-term service, usually up to 6 weeks. It's free to the service user and it's most frequently offered to people over the age of 65, but not exclusively. And over the last 10 years plus, the government has made significant and ongoing investment in reablement, and COVID has seen an increase in the reliance on reablement. So essentially the aim, what government is wishing to get out of it is a reduction in admission to care homes or hospital and reduced need for ongoing care. Yet understanding of reablement is extremely low among the general public, and not just among the general public, but also among health and social care professionals themselves who haven't come in direct contact with it. In England, there's no standard model for its delivery. So there are things that vary, such as who is eligible to be referred into reablement, how that process might work, and as well as who you might find on a reablement team. So some teams might, for example, have occupational therapists on the team, others might not. So quite a lot of variability, which again doesn't help with understanding exactly what it is. So what are the gaps in knowledge? Well, given that we know so much about the critical role that families play in supporting older relatives, you would imagine that their role is acknowledged as critical in the successful delivery of reablement. But I didn't find this to be the case. They're not cast in a central role in guidelines, and there's very, very little UK-specific literature relating to their role. There is literature, some of it in other countries, Norway, for example, some in Australia, but specific to the UK, very little regarding family members specifically. There are NICE guidelines, and they frame family engagement in terms that it's something that should be done as appropriate. But they provide very little guidance on what contexts that might mean when it's appropriate or not to involve families. And that means that there's very little information for those who are working in the field on when it might be appropriate, for whom and in what circumstances. So in other words, very little to translate that guidance into practice. And little to support teams in engaging families in the idea of reablement and how it's delivered and how they might use it themselves. So we know from existing research that reablement teams encounter a whole range of different attitudes amongst families towards reablement. At one end of the scale, you find families who might feel very grateful and reassured, but at the other end, those who might feel far more ambivalent or downright resistant actually to the idea that their relative is being encouraged to do things for themselves. And little existing research has explored anything about how reablement teams might manage those differences. So crucially, we know very little about whether families actually adopt a reabling approach themselves as well following the intervention, and how and whether they continue to apply that approach themselves. So it's ideas around the sustainability of it and the impact of it in the longer term are just not there at the moment. To give you an example of that point that came up within my study, I spoke to somebody whose husband had received reablement, and his particular goal was to be able to dress himself again without help. Now, he managed to do that by the end of the intervention, and it did take him a good 2 hours to do it, but he could do it by himself. Well, the morning that the reablement team left, his wife said to him, right, okay, let me get you dressed now so that we can go out, which makes you wonder how much she had been considered part of that process. And I will return to that couple again at the end of the presentation. So that's at the bottom of that slide is my rather wordy research question, but it's essentially seeking to understand more about what causes reablement teams to engage families in the intervention. As Gary said, the approach that I've used is called a realist approach. So given the absence of ideas about what works when engaging families, I adopted this research approach in order to generate and refine ideas that could subsequently be tested. The approach of a realist approach, its founders are Pawson and Tilley, and at its core is the idea that interventions seldom work for everybody, every time and in the same way. So it works by generating theories about what works and for whom, in what circumstances and how. So in other words, it's looking at causal explanations. And of course, there's an increasing focus on theory in relation to rehabilitation more broadly, research, evaluation, as well as education and practice. So we need these sorts of theories to drive knowledge and practice forward. In the first stage of my study, I built initial theories, and that was through a mixture of input from stakeholders. And I spoke to 3 different local authorities, to a care home which had an in-house reablement service, and to an independent home care provider that promoted itself as being family-centred. I also built those initial theories based on documentation around the guidelines provided by NICE and Social Care Institute for Excellence. So building on those initial theories, I undertook what a type of literature review, which is known as a realist synthesis. And that looks at both academic and non-academic papers and information on the subject area that you're looking into. And crucially, I recruited a group of volunteer family carers through Carers Support Centre. And they were really indispensable in providing the advice and guidance and input at various crucial stages in the project. In the second phase of the project, we then moved forward to refining the theories. And we did this by working through a local authorities, or rather in partnership with the local authorities reablement team. And again, my group of family carers participated in that stage of the study. And this field work involved exploring and refining the theories through realist interviews with staff who were operating at all different levels within the service, as well as a focus group with reablement workers who are the ones who predominantly are the ones going into people's homes to deliver the service. And that was done using the approach of presenting theories to the people who took part in the interviews and focus group, where the theory is the subject for the discussion. So as an example of that, I might have said something like, you know, there's this idea, and the idea will have come from the literature in some way, that if family members are not familiar with what reablement is and what its parameters are, then that will give them unrealistic expectations of the service. You know, what do you think about that idea? And by moving around the theory becomes more and more refined as people discuss it. So I'm hugely grateful to my research participants, because their time, energy and ideas really were crucial to the whole process. And we're not typical of just question answer type interview style. So I identified 4 main theory areas in my findings, and I will just be focusing in on one of them today, but here are all 4. Briefly, that first one concerns the need for families to really understand reablement in the first place, and in particular understand how it differs from hands-on care. The second one concerns really understanding what the family's situation is and their own attitudes to supporting their relative. The third one is the one that I'll talk a bit more about in a moment. And the last one is about the skill set required of the reablement workforce when engaging families in service delivery. For each of those theory areas, I looked at particular contexts that were relevant and what sorts of resources might be introduced into those contexts. And this is something known as a context, mechanism and outcome configuration, which is probably academic speak you don't need right now, but I will just show you an example for those who might be interested in how the theories are developed and come about. So here's the area that I wanted to talk about in a bit more detail, and that's actively empowering families to adopt a reabling approach themselves. And here, I mean, transferring the reabling approach and mindset during its delivery to families so that they can take an active part in it. And also it gives them the confidence and capability to continue applying it beyond service delivery. So this is obviously important in terms of optimizing it in the longer term. The idea of consciously passing reablement skills on to families is generally not considered to be a core activity within reablement. And thinking about some of those contexts there that I put at the top, existing family relationships, there are various sorts, and it's important to differentiate between them. So, for example, families who are new to providing support will be very different to those who have already been providing support. And also people's plans for the level of support they wish to provide in the future will also be a different variable, a different context. So really the willingness and ability of people to provide support is important to understand. Also important here is, well, actually, let's look at that example that I've put here. If you look at the second box along first, the context in this situation set out here, it could be a family who is already caring for their relative, but has not adapted to the standing back approach that reablement promotes. They're more used to doing things on hands-on, don't want to adopt that standing back approach. So something that could be introduced in that case is helping them to really understand the benefits of standing back and the health benefits. So that message of if you don't use it, you'll lose it. And by understanding that message, it could lead to an increased awareness that doing too much for someone can actually act as a hindrance, and that standing back is an acceptable part of a care role. So that's really just a little example there of how families can justify to themselves that standing back is actually beneficial. There was one particular part that I looked at, which is I termed standing back with empathy, and that was one of various mechanisms that I looked at, other ones being teaching by actively demonstrating or modeling the approach to families, or providing tips and guidance. But standing back with empathy is the one that I wanted to pull out, and I describe this as the core mechanism of reablement. So you could consider the skill of reabling as actually having a mastery of not doing things for someone, even when you are capable of helping them or doing it for them. So this would not be considered a critical skill in traditional hands-on care. So rather, standing back with empathy means, it could mean letting the person know that you're on hand to step in if necessary. It could mean encouraging with words only, or stepping in at some times, but not at other times. So it's something that families can learn, and that reablement teams can apply, or rather can teach families, and that can be applied once the intervention is over. So there were lots of examples in the course of the interviews that related to tea making. So in particular, who was making the tea for whom? And that's quite a nice example to think about in terms of standing back with empathy. So it might be that sometimes a family member stands back and lets their relative make tea for them. It might be on other days they step in and provide some verbal prompting, or stepping in and doing it themselves. But this is a good example of what standing back with empathy might be, and adjusting according to the circumstances. So just at the bottom there, several causal factors were identified relating to actively empowering families to adopt this sort of approach. So they included having a good understanding of what reablement is, understanding that health message, sometimes being prepared to work against natural instincts and habits, and also understanding and knowing that providing social support is a valid way of providing support to someone. So just, this is my final slide, and I just wanted to set out some of the implications that the studies have in terms of informing future research and practice. So as I mentioned at the beginning, actively empowering families to engage is just one of four theory areas that I looked at. The theories were mostly developed from the perspective of how teams can facilitate family engagement, but more work needs to be done on refining and testing the theories now with service users and families. COVID did have an impact on this part of the study. I had only interviewed one couple before lockdown struck, but the theories are now transportable to being explored in more detail with families and service users themselves. The study highlighted the hugely complex range of skills required of reablement workers to judge when and how and whether to engage families. And in the UK, engaging families, as I said, it currently happens really on an informal basis, instinctive for many reablement workers. But a review could be conducted into incorporating this more formally in training and support. The details of this study lend themselves to co-production, and co-producing training resources would be a natural next step from this. And they also lend themselves to discussing the themes across different disciplines. So for example, at UWE, I did a presentation like this to a group of roboticists, and they found the idea of standing back with empathy really interesting and something that they could apply to assistive technology, because I think formerly they'd really viewed the journey of an older people as all in one direction. It's down, 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 rather than realizing that no, any assistive technology can also be there to help people do things for themselves. And there might be times when they do want to do things for themselves, some days more than others, but by talking in terms of that mechanism of standing back with empathy, it's a kind of a transportable idea. So finally, in the UK, there's a very strong emphasis in health and social care on person-centered approaches. And this study has highlighted the importance of considering that person within their social context. It demonstrates that families are a distinctive context in reablement. Of course, not everybody has family members, but those who do, it's really important to understand that they can actually either threaten or enhance the sustainability of reablement outcomes. So finally, just thinking back to that couple again, the wife who reverted to addressing her husband as soon as reablement had finished. If she had been empowered to adopt the reabling mindset herself and had confidence in how to apply it, there might have been days on which she did stand back while her husband dressed himself, or she might have applied reabling principles to other aspects of their lives together, but thereby sustaining the benefits in the longer term. And that's all I really wanted to say. Thank you very much for listening, and I will look forward to answering your questions, of course, but feel free to get in touch if you have queries that come up after today. I'm now going to be spending some of my time pursuing opportunities to take the findings further, as well as deciding what next for me. So please do get in touch. There is also a link there if you're curious to know a little bit more about realist approaches. And in your slide pack, you'll also get some references to the works that are looked at. So I'll stop sharing my slides now.
Well, that's brilliant. Thanks, Linda. So do we have any questions then for Kelvin, Jack or Axel, first of all then? So cast your mind back to the beginning of the session. Apologies if you did put a question in there, because like I said, I lost the chat. Yes, so Paul?
I had a question. Fantastic presentation, really interesting work, guys, locally and nationally. I just wondered about the work you do with Age UK. It would be really nice to hear what you thought some of the highlights were of that work and where you saw a meaningful impact of the valuable work you were doing.
Yeah, great question. The first highlight was obviously the opportunity to work with Inspirational K and the rest of the team at Age UK. It was a pleasure to work with Kay and Jen. That was my first highlight. But then, in terms of the research, I thought maybe this would be a good opportunity almost actually just to dive into the kind of findings. I saw the message in the chat and thought it might be good to kind of bring up some of the visualizations. So kind of, I guess, at a high level, we found that there are over 40 different services which could be of benefit to the older people community, and they can be kind of segmented by the kind of 4 different delivery centers in terms of in-person, at home, outside or online. So kind of looking first at home, the types of services which include home care, personal care, handyman, foot care, gardening, hairdressing at home, home care or home share, as well as grass cutting. I won't go through the full list, but you can, I think, see at a high level the kind of things that we were looking into. As I was looking at this a second ago, I have to admit, I have absolutely no idea what men in sheds means, the number 7 on the incentives list. And so we kind of looked at these all at a high level. You can see the kind of broad spectrum. And then we tried to really understand the impact as well as then the viability of introducing such a service. So we went through one by one, understanding the challenges that would be faced internally. And so you can see things like short mobility, cafe, get into golf, we felt were of less impact to kind of more practical at-home based services, for example, looking at things like phone a friend, as well as kind of the dementia and daytime support. But then ultimately, I think then the feasibility was a big challenge in terms of our work actually having impact. So that was the kind of next challenge of how can we bring this forward. So as mentioned, then based on our findings here, we then took this further kind of looking at the high level. This is, I think, just a snapshot of the kind of research we had, the data we had at a base level. So this is just a high level presentation which we delivered to Kay as part of a conversation. But this was really supported by a a very big spreadsheet and a lot of other material. And so, I mean, the one that we really wanted to focus on was home care. Based on, I think, the feasibility of it being introduced, based on other findings, as well as the impact that we felt it would have on the community of Bristol. So we felt that it was the kind of most feasible to introduce. We also found that 2/3 of the Age UK branches across the UK, or we actually only looked at a sample of 56 Age UK branches, focusing on those that were of a certain size, had this service, as well as kind of the number of volunteers that would be needed. And kind of, as I mentioned, for example, with reference to our kind of digital transformation work on the financial reporting, a big piece of the research is also then researching the necessary steps that Age UK would have to take in terms of actually implementing. So a big one there was around DBS checking. So understanding the importance of that in terms of being able to bring the service forward. And so I'm really proud to share that I believe that kind of based on these findings, as well as some of our other recommendations, this is a service that Age UK Bristol are actually now launching, which I mean is a very proud moment for all of us. And you can see also here, I think another highlight in terms of the insights was the type of support that the elderly community can benefit from as part of this wider offer. And so things like domestic cleaning, laundry, paperwork, prescription collection. But this was a kind of huge kind of insight in terms of understanding the feasibility of rolling out such a service, in terms of, I think, really getting into the weeds of the kind of practicalities of what would be expected. And so I think in terms of our highlights and the kind of key insights, it was a kind of top down looking at all of the different things that we thought Age UK could do in terms of kind of extending their offering, and then drawing out such research, such insights to kind of really understand the feasibility of it being implemented. So in terms of the kind of value add, I mean, it's a really proud moment for us to hear that this has been brought forward, and as soon a service that Age UK will be offering to the local community. All right. This is maybe another thing I can just share while on the thing, was just, I think, key other findings from our research in terms of the kind of key factors that would enable the implementation. So things like establishing a dedicated team, kind of in line with the philosophy, continuous monitoring of the service and feedback, as well as kind of the strategic vision that would be required at a marketing level to kind of maximize the social impact. So yeah, if anyone's interested in learning more, I mean, I could talk about our work all day, so I'd be delighted to answer any other further questions.
Thanks, Jack, for expanding on that. That was, I mean, fantastic. Really great to learn more about some of the fantastic work that you've done with Age UK, and some of the findings from that great research. Linda, I don't know whether you've had a moment to look at some of the questions that were in the chat box. So there were some comments about the importance of involving carers themselves in designing your research, and comments appreciating that involvement of carers. And there was a question about that. Given that carers were involved, was there an advisory group of people actually receiving the reablement service?
So sorry, I can't actually see the first part of the chat. When I got kicked out, that lot disappeared. But the group of advisors were made up of people who were family carers rather than people who had experienced reablement themselves. But as I say, in the next, taking the study forward, it would be really important to include staff, carers and service users in co-producing resources.
Great, thanks, Linda.
A question then from Tavis. It said, home care, are families offered any options with care? I think it's a question for Linda.
Do you mean on setting the goals for reablement in that instance? At the beginning of reablement, Goals are set jointly by the reablement team and the person who's receiving reablement. If you mean at the other end of reablement about what are the choices for care that's received at the end of reablement, the service will work again with the person to identify an appropriate care package. And again, you know, that at that point, it's important to understand somebody in the context of whether they're living with somebody else and who's there to support them as well. I can see there was also a question about the possibilities of families expressing concern that the person they care for, if they were able to do more for themselves, that might impact on benefits. And this was something that came up again and again in the study, actually. And it's not uncommon for reablement workers to encounter the situation where they have helped somebody to become more independent, and somebody, for example, can happily get themselves out of bed in the morning and get themselves dressed, but then later on in the intervention, they'll suddenly go in and find that they're in bed and undressed. And when they say, well, what are you doing? You can do this. They'll say, well, my daughter told me not to do it, because if I can show that I can do it, then I won't be eligible for care, or I won't be able to get a place in a care home, which is what my daughter wants. You know, there were lots and lots of situations like that, which is definitely a context that reablement workers need to be aware of, and reablement teams need to be aware of. But essentially, you know, it's working in the direction of focusing on capability rather than inability. Yeah, I don't know if that answers that question there.
Thanks for that. Again, I disappeared, so I've lost all the chat again.
So Kay had a question, and then I can see Jenny Ann Bishop has got her hand up as well. So maybe Kay, do you want to go first, and then Jenny Ann will come to you?
Lovely, thanks. Hi, Linda. Yeah, I was wondering whether or not you saw a value in those training resources being provided more widely than to reablement staff or families, because it seems to me that actually there are lots of other staff and volunteers who are working with people and supporting people daily, and sometimes potentially, you know, there's kind of 15-minute pop-ins for home care support. You know, I'm just wondering if they could really scupper things and undermine reablement. Did you have any thoughts on that?
Yeah, I think that the mindset of reablement and that mindset of, you know, standing back with empathy is something that can be applied to so many situations, and that any resources developed for this could be applied to other situations. So yeah, very much so. But it does rely on that understanding of the health message behind it, and that capability, you know, should be encouraged and supported, but how to do that and what elements contribute to that. So again, there's this valuing of company and social interaction as part of the way to support somebody in the life that they want to live, rather than simply doing things for people.
Jenny Ann, did you want to turn your mic on and ask your question?
Yes, thank you, Paul. Hello, Linda. Thank you for that very interesting presentation. I just wondered, did any of the people who were offered reablement resist? We have somebody locally we try to support who is absolutely against the reablement team because she feels if anybody comes in to help her, they'll decide she needs to go in a home, even though we keep telling her the team are there to try and keep her at home.
Mm-hmm. And this comes back to that idea of a real lack of understanding about what reablement is. And the service that I worked with in the research, comes across this a lot, that people are expecting to get free care. And, I'm sad to say that actually some of the NHS materials on reablement refer to it as free care. So it's really important to get that message out there that it is different to hands-on care. And of course, if somebody is expecting to get hands-on care, and then they discover that actually somebody is standing back, then that can be a very worrying situation to be in. I spoke to somebody who had experienced that feeling, and he expressed it as feeling as though he was being watched to almost, seeing when he would fail, and that was a family carer, but he hadn't understood what reablement was, and as you say, in spite of attempts to educate him in what reablement was, he had it in his head that what he wanted for his wife was hands-on care. So there's a big public health education program to be had alongside reablement, and it's working out easy ways to communicate what it is, so that people don't have unrealistic expectations, and that it can really do the work that it's there to do, which is, as I say, very, very different from just doing things for people.
Thanks, Linda. Thanks, Jenny Ann. And there's a comment on a similar note, really, from Anne Raffle in the chat. If family members don't understand what reablement means, this can often set them against each other, creating additional issues. I don't know whether that comment resonates with some of your work on this topic, Linda.
Yeah, most definitely, which is again why understanding where families are coming from in the first place, and you might well have a discord between what the service user themselves would like, and the level of independence that they would like to have following reablement, versus what their relative might want. Their relative, we often hear that relatives just want their older family member to be safe. They don't want them to take risks by doing things for themselves. So it's an extremely demanding job to be doing, to be working out, some of those family dynamics, which I think is what that comment is pointing to there.
Thanks, Linda. Are there any other questions for Linda or for the first presenters, Jack and company? Jack, Calvin, and Axel.
Kay, you got your hand up?
Yeah, just wondered if for the first presenters, really for Jack, Axel, and Calvin, I just wondered, obviously a number of us in Bristol have benefited from your valuable expertise and time, which we're very grateful. But I just wondered, is this something that is still an offer to other organisations in the city or elsewhere? And is the team still available? Really, is the ask, I guess, for anybody else who's interested.
Absolutely. I guess at a high level, to kind of, I think, just re-communicate what the offering is. We are a large network of students that run completely free of charge consulting projects that last about 2 to 3 months. They're completely bespoke and aligned with your organization's ambitions or kind of problems being faced internally. So if you're looking for capacity to help, look at innovating your business model, look at new ways of redelivering your services, kind of the digitizing of existing programs, the building of your online presence, or we've done a lot of work around fundraising in terms of looking at income streams and kind of potential fundraising campaigns. And so there's kind of two sources of support that you could seek, and please do for both, as they're both at your complete disposal. The first one is CSRN, kind of us as an organization. But our work at the moment is primarily focused on supporting charities in developing regions. But all of this stems from another organization that I set up at the University of Bristol called 180 Degrees Consulting Bristol. And so 180 Degrees Consulting Bristol is still running. It's about 80 students large at a given time. They work with about 10 to 15 charities every term. So if anyone would be interested in having some students work on a consulting project for them, feel free to contact me directly, and I can speak with 180 Degrees kind of directly, or look at creating capacity internally our side. So yeah, would love to hear from any charities or any organization that you know within your network that might be interested in receiving our support.
I'm sure there will be. I'm sure there will be. So we'll be distributed those links. There seems to be one final question for Linda, and then we'll wrap things up for today. But this is from Kay. It says your work would be valuable for the NHS and adult social care, as both are looking for preventative approaches. Do you have any links into these locally?
Am I unmuted? Yes.
Yep.
Only really the links that we have at UE anyway. So I would love that to be the next step in this research, to be able to take some of these findings forward and apply them. That would be great.
That's brilliant. I mean, it's been two excellent presentations this afternoon. The reablement stuff, it's a fundamental shift, and it's incredibly important and empowering, and I think that's so it's the more around that, the more awareness raising, it's fundamentally important. But I'd like to thank everyone for attending this afternoon. The video will be available. It will be posted online shortly. The next forum, importantly, is the 25th of November at 11:30. And we'll look forward to seeing you then. And thanks everyone for attending this afternoon. Thanks for all our presenters, and take care, everyone.